This is an interview with Herman, a renal medullary carcinoma survivor. I made a chubby emu video describing his case, link in the description, but here is the man himself telling his story and how it all went down. This is a high-grade aggressive cancer linked to sickle cell. Median age of diagnosis is 28 years old. Less than 5% of people who are diagnosed with this cancer survive past 36 months. Here's Herman.
Around the time I graduated from college, the economy wasn't doing well during that time. It was the time when the recession was going on. So after graduating college, my main focus was to get a job. Many other college students, I went to school with many friends, we all were searching for jobs and just applying to any job that we could get. It was really quite difficult afterwards because you have student loans that you're obligated to pay back, and when you're trying really hard to get a job, that was basically most of my life after graduating, was just trying to find a job to hopefully start paying back my student loans and get a career started. That proved to be difficult with the economic situation at the time. Around the time I noticed I was feeling sick, I had worked a seasonal job earlier that year. Once that was over with, I decided I would go back to school. Medical school at the time, or graduate school, was what I was thinking of pursuing. I ended my job search and decided to just focus on studying for the GRE and the MCAT at the time, as well as maybe looking for a part-time job. In August of 2011, I noticed just a light tickle in my back near the rib cage area. It was persistent on a daily basis. It was almost like an itch that you couldn't scratch, but it was deep. Eventually that tickle became a dull ache, and the dull ache became a pain by December of that year. The dull ache, I thought maybe it was my mattress, because I wasn't working out or exercising or anything at the time, so I knew I didn't do anything physically that could have, hurt my back or cause back pain. So I began to think maybe it was my mattress. I went to visit my sister in Colorado. The back pain started to get better, so that sort of made me think, maybe it was my mattress, since I was sleeping on a different mattress over at my sister's place. And then when I came back, the back pain eventually started back up maybe 3 weeks later. Into the next year of 2012, that dull ache became more of a pain sensation, and then the pain sensation started to radiate down towards the groin region. And then maybe a month after it became pain sensation, I would receive a sharp pain in the back region. And whenever I felt the sharp pain, I would also have a sharp pain in the groin region. So I began to suspect that maybe the two were connected. And around that time, I had no health insurance, so I was kind of worried about, medical bills when I had student loans and everything to worry about. I remember talking with one of my sisters and saying if the pain didn't get any better by the end of the week, I would go to the ER and see what was going on. And then when I got off the phone with her, I noticed blood in my urine. When I saw blood in my urine, my first thought was maybe kidney stones. And, like most people do, I head over to the internet and Google, and the first thing that popped up at that time was cancer. I didn't believe it. I was fairly young still and, healthy and doing all the right things. And I didn't think, cancer was a possibility for me. I thought maybe it was kidney stones. When I went down to the ER, even the nurses thought that maybe it was kidney stones. So I was feeling pretty hopeful. They took me back to do a CT scan. And then they took me back again to do another CT scan with contrast. So then I, kind of start to get a little worried.
I remember Herman sending a text at one point saying they think it may be kidney cancer, but we were just like, oh no, there's no way.
Then when they came in and told me the results of the CT scan, it was cancer. So I just sort of tuned everything out. I honestly, it was like in the movies where, someone's talking and all you hear is womp, 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 womp. I could just remember hearing the background noise of the ER, but not really, taking it in because I was, just so in shock and amazed, so I really didn't know what to believe. During the months leading up to that, I had developed a cough, fairly early in 2012. Anything of it, but the cough, got worse as time went on, just as the pain, got worse. So after they told me it was cancer and then I started to cough, my degree was in biology, so I had a basic understanding of cancer. So when I coughed, I kind of put two and two together and just thought, oh no, I knew it had probably metastasized to my lungs at that moment. The first ER doctor that I saw, he told me to come back and see him if they gave me any problems. And at the time, I didn't understand what he meant. Why would they give me, problems, seeing what I was diagnosed with or whatnot? I've never had any problems growing up with any sort of in the healthcare system. I didn't know that, and when I called, the urologists weren't accepting any patients without insurance. The paperwork I had received, I guess, had like authorization, although I didn't have insurance at the time. It, gave me authorization to still be seen, so I had to repeat myself about 3 times, and on the 4th time, the person, finally asked what the number was after telling me, 3 times prior to that the urologists aren't accepting any patients without health insurance. And, they were brief with me on the phone. Eventually, they scheduled me an appointment, but so I went back to the ER. One of my sisters kept, calling around and, fighting for me, trying to get me an appointment scheduled. It wasn't until after that they were able to schedule me an appointment with someone from urology. And, it was just a headache the entire way of just trying to even get an appointment or get seen by someone from the urology department. Even after I was scheduled an appointment, I had to drive to an affiliated clinic maybe 45 minutes to an hour away just to get that appointment, because the appointment they originally set for me was months later. So once I was at the affiliated clinic, I was seen by someone from urology. At the time, they didn't know whether or not it was cancer. They seemed to not know. So I was a bit confused because I had received a report from the ER stating that it was cancer, and then when I saw the urologist, they seemed to not know whether or not it was cancer. And I remember the person I was seen by asked, if I was in the military and overseas and had maybe, picked up an STD overseas and, something about a urinary tract infection. It just didn't make any sense to me. I didn't understand the disconnect because the ER clearly stated that it was cancer, but when I went to see the urologist, it was like they didn't know what was going on. At the urology office, once I was seen the first time, they wanted to schedule a follow-up even further down the road. And, it was just a hassle the entire time, just trying to get seen by anyone. With the follow-up, they wanted to do an ultrasound, I believe it was. I didn't understand that either because I thought maybe the CT scan would have provided better information as to, what was going on. So I didn't understand that. And then also they wanted to do an MRI, but they told me the earliest they could schedule an MRI was in September. And this was April, so that's like 5 or 6 months down the road that they're telling me that they could schedule me for an MRI. That made no sense to me. One of my sisters calling around, people she knew at the organization, was able to schedule me an appointment much sooner than that to have an MRI done. But, I didn't understand what the disconnect was with the information from the ER and as to why the urology department didn't seem to really understand whether or not it was cancer. They also scheduled me for a biopsy, but this was after, the ultrasound and the MRI and all of those things. From what I had seen online, once I, started researching the cancer, it didn't make sense for me to wait 5 or 6 months to have an MRI done or anything done because all of the information I had seen about the cancer online was not good, and how patients had passed away within 6 months of being diagnosed. So, it just really didn't make any sense to me at the time. And even with follow-up visits to the urologist, it was always, it seemed to be less concern from the urologist than there was from the ER doctors. The ER doctor seemed to be a lot more concerned than the doctor from the urology department. And the doctor from the urology department that I saw was always real, brief with me. And, you just kind of know when you're being blown off, I would say. I finally was able to get his attention on the way out of the room and let him know that I had a cough for several months that kept getting worse and that my chest burned when I breathed. So that really caught his attention, and then he scheduled me to have an x-ray done of my chest, then an appointment with the internal medicine department. When I went to the internal medicine department, just from them having my records and whatnot and seeing what was going on, they showed a far greater level of concern than the urology department. I didn't understand that either, but just the treatment from the internal medicine department was, far better than I was receiving from the urologist or, anyone in the urology department. And the internal medicine doctors and staff were, quite concerned for my health and well-being. The internal medicine department, they, got back to me about my chest x-ray, and they told me indeed that the cancer had metastasized to my lungs. After that I still had follow-up appointments with the urology department, and it was always about surgery and removing the kidney without any sort of further investigation, no talk of any, chemotherapy or anything like that. I had the biopsy done to, confirm whether or not it was renal medullary carcinoma. Even in dealing with that, I expected to have blood in my urine after, having a biopsy of my kidney done. That happened, and it stopped after about a week. And then maybe a week later, I began to urinate blood again. It was to the point where I was really concerned. I called the number that they gave me, couldn't get anybody, so I tried the ER again, called someone from there, and I was just flat out told, by that person on the phone that it's not right and it's not fair, but people without insurance, they put towards the bottom of the list. I remember just going to the ER that night or that day and staying nearly 10, 12 hours by the time I was done. So thankfully, the next day, the blood in my urine had cleared up. And when I had that follow-up appointment with the urologist, I had talked to the urologist about it. I, let him know that I was concerned that, just even literally taking a sip of water, I would urinate probably maybe a liter or so of just straight, red. So I was concerned about that. And his reply was something along the lines of, it's to be expected if you just had a hole punched in your kidney. It's like, I get that, but literally just taking a sip of water, the volume of urine that I was releasing was like way disproportionate, and it was just all red. So I was concerned about that. That's just the reply I got from the urology department.
I think the main thing that kind of took my breath away was like how nonchalant he was about the entire thing. It was like no sense of urgency at all, especially once we had Googled the type of cancer and we knew what it was. It was like time is of the essence. There's just no time to delay these scans or whatever else it was he was wanting to do. We knew that it needed to happen right away. When we saw it wasn't happening right away, it was kind of like, okay, well, what are we gonna do? We need to make some decisions now. They didn't really seem to care. The way I look at it was like he didn't have insurance. They saw the type of cancer he had, probably had never treated it before. Instead of giving him a referral to an academic center that did know how to treat it, they just kind of brushed him off, kept brushing him off, as if to say, well, you're gonna die anyway. That's the way I felt. I just think there should have been more of a sense of urgency with them.
I came across, like a cancer messaging board online, just seeing what other patients and their families were saying about that particular type of cancer. I came across a Dr. Tannir's name 3 times maybe in that messaging board. I thought maybe it was the same person, repeating the same doctor's name, but it was 3 separate people at the time that were named Dr. Tannir. So that's when I Googled and, found MD Anderson, saw that he was a doctor there. I could see his profile. I could see numerous publications and whatnot that he had, and he just seemed like really experienced. I really didn't know if he would reply or not, so I just reached out and sent him an email.
I remember the day, April 22nd, 2012. I was in Munich, Germany, giving a talk on kidney cancer. And I got this email on the weekend, on a Saturday. I remember it like it happened this weekend. And an individual emailed me, very concerned and very anxious about being diagnosed with RMC, and was scared and was given a bleak outcome, a bleak future. I responded to him, said, do not despair, and there is hope. And I'll see you in the clinic when I return. And that's what happened.
Dr. Tannir explained to me that he has experience in dealing with renal medullary carcinoma and that they have experience dealing with it at MD Anderson Cancer Center. I was a bit concerned because they were located in Houston, Texas, just not being from there, and the whole issue with health insurance and whatnot, not being a resident of that state. I really didn't know how I would be seen by him in that clinic. So
when the doctor, they said, there's nothing we can do here for you, I went to the airport, picked up a rental, and then we drove 17 hours to Houston. I just remember Herman being quiet the entire ride, just because the cancer had already spread to his lungs, and he had that uncontrollable cough. So if he tried to laugh or if he tried to talk too much, he'd just start coughing uncontrollably.
After several emails with Dr. Tannir and his staff, they took into consideration that I wasn't from there, that I didn't have any insurance, and that I wasn't a resident of Texas. So he spoke with the highest authorities at the hospital, he told me, and explained to them my situation, and they were able to approve me for an override for me to be seen out there, to be, I guess, treated as a resident of Texas, because if you're not, you would have to pay for everything up front right there. With the override, he made it so I could be seen and, I guess, treated as a resident of Texas and not billed up front on the spot.
So Herman came with his sister, Cora, to the clinic, and we confirmed the diagnosis of RMC. He presented with weight loss, fever, cough. He had a mass in the right kidney, and he had spread of the cancer to the lymph nodes and to the lungs. So we began a series of treatments, and this is in 2012. Cytotoxic chemotherapy that has been the cornerstone of treatment for cancer for decades, and is what has been mainstay of therapy for renal medullary carcinoma, or RMC, at the time, and it still is. So we treated him with a combination of two drugs, paclitaxel or Taxol and carboplatin.
So my first treatment, the first day there, it was just more CT scans, a bone scan, an MRI of the head, and things like that. So just within the first day, just numerous scans the first couple of days, and then by the third day, chemotherapy. Actually, here the urologist wanted to remove my kidney, and in talking with Dr. Tannir ahead of time, he explained to me that systemic therapy or chemotherapy was the mainstay to shrink the tumor first and then remove the kidney. But here there was no talk of anything of chemotherapy. It was all, we could remove the kidney, just that type of talk, but no talk of chemotherapy first to reduce the size of the tumor or anything like that. Just even after the second round of chemotherapy, they noticed a significant decrease in the size of the tumor. So I was pretty happy and thankful for that, because just given all the information I read about the cancer, it wasn't really good. I was pleased to know that it had such a good response to the chemotherapy. Quite honestly, after the first round of chemotherapy that I had that same day, I was pretty worried because I didn't have any pain medication with me at the time, and the pain from the cancer was just excruciating. I was worried that during my treatment I didn't take my pain medication ahead of time, so I was pretty worried that I would wind up in pain during the treatment. I could feel a difference by the end of the day, and I didn't need my pain medication at all just from having the chemotherapy. So I sort of, thought maybe something good was happening, so I received a call from Dr. Tannir just after the second cycle of chemotherapy, explaining to me that there was a significant reduction in the size of the...
He had an excellent response. He felt better quickly. And after 5 cycles, I remember the number of cycles we administered. After 5 cycles, I sent him to one of my colleagues, Dr. Jose Karam at MD Anderson, to remove his right kidney because he had such a fantastic response. And I knew that removing the kidney will be in his benefit. So we did that, and long and behold, when we reviewed the pathology of his kidney, we had to look hard to find where the tumor was in the right kidney. He had such a fantastic response. Not only his tumors in his lungs and lymph nodes disappeared, resolved, but even the mass in the kidney was gone, and there was only a minute focus of residual RMC in the kidney.
I would say right after surgery, just immediate pain. You just wake up to immediate pain.
And you remember the pain?
Yeah, I remember the pain. I remember just maybe 5 minutes before opening my eyes, I could hear someone repeatedly calling my name. Just being in pain and then opening my eyes, and the pain was pretty tough. I was just in and out of being awake and being asleep, and they give you I guess like a morphine button, and you press it once every 10 minutes. They had to keep placing it back in my hand because I was always, I wasn't fully awake yet. The anesthesia hadn't, worn off. So I know they were pretty frustrated with having to keep on, placing the morphine switch back in my hand, but it's like, I don't have any control over that. Like I kept falling back asleep and, just in and out of being awakened, sleep until the anesthesia wore off. Just being in pain, but surprisingly, as each day passed by, the pain got a little bit less. It was still, pretty intense, but not as intense as, I thought it would be. Like, it got better as every day went by.
Post-operatively, after he recovered, at the time, the era of target therapy for the most common type of kidney cancer, clear cell renal cell carcinoma, was in vogue. And so after he had 5 cycles of chemotherapy, I wanted to give him a break from the chemotherapy and not to resume it right after surgery. So I started him on a drug called pazopanib, which is one of the drugs at the time that was approved for kidney cancer for the most common type, clear cell. And after 8 weeks, we repeated his imaging studies, the CAT scans, and his disease had recurred. And that was very disappointing, of course, for us and for Herman, because that 8-week treatment with this FDA-approved agent for the most common type of kidney cancer didn't touch his RMC. So I tried a different cytotoxic regimen, a different combination of chemotherapy drugs with doxorubicin, it's also known as erythromycin, and gemcitabine, Gemzar, and he did not respond. So I went back to what worked for him in the beginning, but at this time, I told Herman, this is a long journey. We're going to have to be aggressive. I'm going to continue giving you this treatment as long as you're able to tolerate it. And I'm not going to stop at a finite number of cycles. I'm going to treat you like I treat acute leukemia. We're going to have to hammer this RMC until we eradicate it. And we did. And he put up with it, and we treated him for about 2 years.
They were worried about stopping, any chemotherapy. So after a series of scans, I would say maybe a year later after chemotherapy, the scans that I would have prior to chemotherapy, things looked to be steady for several months. And since they seemed to be steady, they, decided to give me a break from chemotherapy and then just continue to monitor with scans and see how things were going. So in the subsequent visits, thankfully, everything remained stable in those scans.
Today, I can say that he is a cancer survivor. He is now 9 years since I initially met him. Herman has become the beacon of hope for patients with RMC the world over.
So what I would tell a newly diagnosed RMC patient today is do your best. I know that's what I told myself when I was diagnosed, and reading all the little bit of information that there was at the time on the cancer. None of it was, any good. And I was really, I guess scared and concerned because, it's nothing, physical in front of me that I could, defend myself against, So being able to, let go of something that I didn't have any control of and tell myself, that I would just go through the chemotherapy and, do my best. That's what I told myself, and, try not to focus so much on any of the negativity. I know there have been some improvements, I would say, since I was diagnosed. So stay hopeful because, things are changing, and hopefully, there are better, therapies and, more effective therapies and treatments on the horizon. So stay hopeful. My name's Herman Connor, and I'm an RMC survivor.